I always ask this. So if you had to pick your favorite GPCR, what would that be? Cannabinoid or vasopressin or any other GPCR?
Well, I must admit, we use beta-2 adrenergic receptor as our guinea pig, as everybody else does. It's a wonderful receptor. Like
Yes.
it is really good, and there is still plenty of new ligands to develop for this receptor.
Yeah.
And we're discovering new things about it, despite this being one of the first receptor being cloned, and the first receptor for which drugs were developed, beta blockers, by who developed beta blockers?
That's a good question. I'm blanking here. Yet it's
James
still
Black.
Yes.
Yeah, by James Black. So we have drugs for it for 50 years. And of course, propranolol is probably one of the best-selling drugs in the history of medicine, right? So it's still.
Yeah, no, I agree. And it's interesting because it always works. The beta-2 has always been.
Yeah, it's a wonderful receptor. So we use it as a go-to system. Every time we develop a new assay, beta-2 would be the first one we try it on. But of course, and also, whenever we develop machine learning approaches to understand what makes agonists, we also did it on beta-2, just because of the sheer amount of data we have for it in the literature.
Exactly.
Cannabinoid receptors, and of course, it's a good target. Cannabinoid receptors are fascinating. They're quite challenging. Of course, maybe I'm biased because I've invested so much time working on them. They're there and they're not there, and what exactly do we do? We still don't quite understand. So we have wonderful drugs today in the clinical trials. So I think that large pharma and medchem people did wonderful. They're very selective, bioavailable, soluble. They are fantastic drugs. They don't get degraded by the liver. Everything you could dream of as a drug, and yet they fail in the clinical trials.